Welcome to the recorded version of the Grantmakers and Aging web seminar, Making Elder Justice a Reality, the Federal and Philanthropic Perspectives, featuring Kathy Greenlee, Assistant Secretary for Aging, Terry Fulmer, President of the John A. Hartford Foundation, and John Feather, CEO for Grantmakers and Aging, from January 15, 2016. This event was made possible by a partnership between Grantmakers and Aging and the John A. Hartford Foundation. Technical and production support is provided by the American Society on Aging.
Well, thanks so much, Steve, and Happy New Year to everyone. Welcome to this session, the first of our Grantmakers and Aging sessions, Conversations with GIA for the year. We're very excited for this session called Making Elder Justice a Reality, the Federal and Philanthropic Perspectives. We have almost 500 people registered for today's topic, so it is clearly an important but often difficult topic for us to talk about. Before we begin, I want to thank the John A. Hartford Foundation for their continuing support of the webinar series, which allows us to provide this information to you free of charge. We also want to thank our co-sponsors for today, the Administration for Community Living and Grantmakers in Health. Elder abuse, neglect, and exploitation is a silent problem that robs seniors of their dignity, security, and in some cases, their lives. Up to 5 million older Americans are abused every year, and the annual loss by victims of financial abuse alone is estimated at least $2.6 billion. Today, you will learn about the scope of the issues, how the government and philanthropy are working to identify and solve the complex issues involved, and new approaches in which we can all play a role in the solution. We are pleased and honored to have two of the most important voices in the field join us today. Kathy Greenlee is the Administrator of the Administration for Community Living and U.S. Assistant Secretary for Aging, and Terry Fulmer is the President of the John A. Hartford Foundation in New York. We welcome you both. Kathy, let's start with you. Please share with us an overview of the issues around the different forms of elder abuse and elder justice, and the new strategies at the federal level to respond to this issue.
Certainly, John. Thank you for inviting me. It's an honor to have a chance to kick off your webinar series for this year and talk about an issue that is just very close to my heart, and wonderful to have a chance to do this with Terry Fulmer and cover a topic that I know means a great deal to all of us, as well as obviously 500 people who are participating. So let's go to the first slide. This really is a bit of what, John, you just said in the setup. First of all, it's important that people know when we're talking about elder abuse, we're talking about a broad range of different kinds of abuse. It's not just physical abuse, and it's not just financial exploitation. It's all of the above. That actually complicates the work in many ways, because in order to adequately provide best services or interventions, we really need to talk about the range of problems. When we talk about an estimated 10% of older adults having abuse every year, the number is so large it becomes a bit numbing. In the field of aging, we're often talking about the age wave happening in this country and really around the world. And in this country, 10,000 people turn 65 every day. So 10% of those, 1,000 every day, will eventually be at risk for abuse every year, and this will continue to magnify. And like you just said, John, I mean, people who are victims of abuse of any kind are more likely to die more quickly and become more ill as a result of the abuse. And unfortunately, very few cases are reported, whether they're physical abuse or financial exploitation. So what I would like to do is flip to the next slide and give you a sense of the federal role, and then turn my attention to what we've been doing specifically through my organization, and make this more concrete with regard to cities and communities, because I know many foundations around the country are very locally focused and locally based, and I think there's a lot that we can do quite literally from the ground up to tackle the problem. So I wanted to start and just at least describe kind of the high-level view. Every year in June, and this is not on the slide, but June 15th of every year has been recognized as World Elder Abuse Awareness Day by the United Nations. And a couple of years ago, actually it's been almost 4 now, in 2012, the White House held the first ever meeting to talk about elder abuse that any White House had ever held. It was a seminal event. And one of the things they did almost 4 years ago was announce the creation of the Elder Justice Coordinating Council. When the Affordable Care Act passed in 2010, the Elder Justice Act was part of it, and we have many stakeholders to thank for their efforts. It took about a decade to get the Elder Justice Act passed. The Elder Justice Act called for the establishment of 2 different advisory boards, and one is the first one that's listed here, a coordinating committee across the federal government so that those of us who have responsibility for these broad federal programs talk to each other. The Secretary of the Department of Health and Human Services is designated by statute to be the chair, and the law also specifically talks about the Attorney General. So the Department of Justice serves as a de facto co-chair or vice chair and has provided significant support for this work. These are the other organizations and federal departments that have participated, and I think they're pretty self-explanatory. People will know who the Department of Justice, Veterans Affairs. But I do want to mention the third one on there, the Corporation for National and Community Service, because it may be one of the more unknown. People will know it by its AmeriCorps programs. They run 3 senior corps programs in the states. Those are the Foster Grandparent Program, the Senior Companion Program, and the Retired Senior Volunteers. So they have a lot of work that they do with volunteers around the country and their staff to support older adults. We have had broad participation from all of these members since we established this council in October of 2012. So your federal government is talking to each other. The other council is not listed on here, but I do want to mention it to acknowledge the work that the advocates have done when they passed the law. The law really contemplates a federal body that's public, a federal advisory committee, and that has not been established and I think continues to be on the wish list of stakeholders moving forward, that we have an opportunity to also have kind of public members on a committee to advise us on the work. So let me go to the next slide. I've mentioned some of it already, I think. We held our first meeting in October of 2012 and had spent the first year in a very public way taking recommendations from experts in the field on a broad range of issues so that we as federal leaders would know where we should focus our attention. So we had the benefit, really, of the experts in the United States to come talk to us about this. We produced a report to Congress and developed a list of strategies where we felt we should organize and coordinate our efforts. And these strategies, I think, also resonate in the state-level communities as the focus. So let's go to the next slide. And I'd like to read the next slide backwards. I'd like to start on the right because I think it's more logical and just intuitive. And I don't want to skip over these too quickly, and I sometimes do that. But first, if we're going to really tackle elder abuse as a nation, we need to talk about improving awareness and prevention. We need to make sure that people know about abuse and work to prevent it. And we came up with 4 different recommendations in that regard. To develop, we need a broad-based public awareness campaign. We need to do cross-disciplinary training on elder abuse. That's why I pointed out on the first slide the breadth of the type of abuse. We need to train people about all the kinds of abuse, but we also need to train a multitude of professionals everywhere from law enforcement to faith leaders to community social service providers, medical professionals. Everyone needs some training on elder abuse. And we need to continue to focus specifically on financial exploitation, including abuse by fiduciaries. So people who are taking care of older people's money. That's why when you look at the list of federal agencies, it's so essential that we have some of the financial partners like Treasury and the Securities and Exchange Commission, Consumer Financial Protection Board. They have to be at the table. This is the largest growing sector of elder abuse, financial exploitation. And then fourth, in terms of prevention and awareness, is to improve the screening for dementia and cognitive capacity, as well as financial capacity and financial exploitation. Dementia and cognitive decline are huge risk factors for someone being subjected to abuse. And when someone starts to get dementia, their first function that they lose is their ability to handle their money. It's the executive function that's first impaired. And as I talk about this publicly, I point out that we in the field of aging have really improved our ability to care for people with dementia in their homes. So someone may be living independently with dementia and otherwise be safe but still be at tremendous risk for abuse of any type. And then moving back to the left, we also need to improve our response, support the investigation and prosecution of elder abuse cases. The Department of Justice has put in a tremendous amount of information on their website to train prosecutors. They're working with victim witness coordinators. It is possible to investigate and prosecute these crimes, and in many cases they are crimes, and we need to continue to work with law enforcement and prosecutors. We also need to enhance our services to elder abuse victims and develop a national adult protective services system, and I will talk more about numbers 2 and 3 in a little bit, and develop a federal elder justice research agenda, and I know Terry will be tackling that a little bit in more depth in her remarks. I mean, we are decades behind other fields such as domestic violence, sexual assault, and child abuse, and we simply need research in almost every direction as we respond to the problem of elder abuse and how to provide both prevention and response. So let's look at my next slide and talk about what we've been doing. This is kind of a litany of what we've been doing through the Administration for Community Living, which is the organization that I run, which is a combination of the Administration on Aging as well as some of the disability programs that serve people with disabilities, all types and all ages. We have core programs. These are primarily Older Americans Act programs that provide money to states for elder abuse prevention. We've had a national long-term care ombudsman program since the late 70s. We provide legal assistance to support individuals who are older who need help, and also do work in the area of fraud prevention, financial security, largely through those programs that we've listed above. We fund a number of resource centers. The first one, the National Center on Elder Abuse. I know Terry has some pictures and information in her slides because I think Hartford is providing funding as well. This was real important to me as I came here almost 7 years ago, that we do what we can to help have a place for people to go for information about how to respond to elder abuse. It's also important as we do this work, we understand that there are some cultural differences in communities, so we also fund a program for Indigenous elders, and I want to make sure that if people are working in Indian country, that they reach out to that organization. University of North Dakota does that for us. Because we want to be culturally competent as we do the services. And then I've listed 3 other resource centers, the Legal Resource Center, Long-Term Care Ombudsman, and Supported Decision-Making. Supported decision-making is kind of a new concept, so I wanted to just briefly describe what it is. As we do work in the fields of aging and disability, we understand that many times people have a cognitive impairment of any kind, and they can make many of their own personal decisions, but need help in some regards with some decisions. And so we have funded a resource center to look at how we can modify guardianship laws, avoid guardianship, put instruments in place so that we can support individuals. And this is certainly germane as we talk about people with cognitive impairment who are at risk for financial exploitation. And then I've listed some prevention grants. The White House was helpful in getting about $5.5 million for us several years ago so we can test interventions in communities. We've helped work with the Institute of Medicine to talk about global violence and have a strong partner in Social Security Commissioner Carolyn Colvin as we look at the Representative Payee Program. This is a Social Security program where people, they can't handle their money anymore. Someone handles it for them, and it can be tremendously helpful and also tremendously risky for individuals. And so we have to pay attention that it not become an opportunity for someone to abuse a Social Security beneficiary. So I want to talk about what, in the next slide, has been some of the most promising and innovative work that we've done. This is my favorite slide in my whole presentation. I want to talk about adult protective services and do a little bit of background. When I say in 2014 we created the first federal home for adult protective services, it's significant. Until that time, the federal government had no formal role or relationship with states for adult protective services. And I found in doing this work I had to start sort of re-educating the world about the difference between adult protective services and child protective services. They only sound alike. They, in reality, are very, very different. At a federal level, we've had an Office for Child Protective Services for decades. We have dedicated funding for states for child protective services. We have education, funding for Child Protective Services. We've had none of that. We never built a federal infrastructure for adult protective services at all. Instead, what this country developed on a state-by-state basis is a 50-state strategy. Every state has adult protective services, and every state does it slightly differently. The age of people they support is different. The qualifications of the employees is different. How they classify the abuse is different. Their jurisdictions, their outcomes. We have 50 committed jurisdictions doing 50 different approaches to adult protective services. And we should be thankful that the states have stepped up and done this, but it also then very much creates a patchwork across the country and gives us no real sense of what the national picture looks like, both in terms of data and quality. So when we created the office, I think it was the first time that the federal government could catch up with and participate and support the states in this work. So we have done this in some specific ways that are listed in the bullets at the bottom. We have created a national strategy so that we can respond on a number of different in a number of different ways. There had not ever been like a federal response or federal strategy. We created guidelines for states, and these are not regulations, but these are guidelines, and we feel like as federal leaders that we have a responsibility to say back to states, here's what we think good looks like. Here's a best practice. This is what we think we should strive to in this country to provide adequate services. And in almost every state, adult protective services serves people of all ages, and this is how we think that should be done competently. We did not create those guidelines in a vacuum. We took a great deal of time to consult with many experts in the field, convened expert panels, put those out for comment last fall, and very soon, I think next month is the goal, we'll publish final guidelines so that we as a nation can start talking about what we think quality looks like. And equally as importantly, we have started to build a national data and reporting system. And this is historic. And for those of you who now can follow along my 50-state map, think about the project. We have 50 different kinds of data sets describing the problem and the response. And what we have built with support from colleagues at HHS is a prototype by working with people who frankly developed the Child Protective System, Child Protective Data System, a prototype on how we can start to link all of these states in a common database. And we are piloting that now and have received funding support from the President and Congress so that we can start to gather national data by connecting states. And we also fund a National Adult Protective Service Resource Center. So I'm getting feedback just to let Steve or John know. We fund a resource center as well to provide technical assistance to the states. And this is historic work, and it's some of the work that I think I'm most proud of as we leave a good system in place, as we change administrations and really look at the future of providing good services. So let's go to the last slide, and then I'm going to turn it over back to John. We have done this work in close coordination, like I said, with the Department of Justice. And several years ago, Department of Justice and HHS convened these very similar experts and put together a roadmap, which is a comprehensive overview that very much is in line with those 8 priorities that I just mentioned, to talk about what we need to do. And I would encourage all of you, I think you can access this through the National Center on Elder Abuse. If you want to know, me, what can I do? I'm a little person in a little state or community. What can I do? I would encourage you to look at the roadmap because it's really designed for people to kind of get an impression of where they might be able to participate. We need for people to know about this more. We need more researchers and more research. We need to talk to and train family caregivers. You know, I've had people in the family caregiver space come to me and say, we never thought about this before, but we really need to talk to family caregivers. There's a tremendous cost to both individuals physically, emotionally, but also financially and to the country as people are abused and incur costs for both long-term care and health care. And we need to invest more. There is still no federal funds that funds directly from the federal government to the states for adult protective services. Unlike Child Protective Services, states may spend some of their social services block grant, but we still don't fund staffing and resources at the state level. And what I would encourage for those of you who kind of figure out what you can do to help, I would think as broadly as you can about being interdisciplinary and multifaceted, and think about who all could help participate in this space, because what we know, regardless of sort of where you enter the conversation, you can't do it alone. Older adults impact all of us and interface with almost every system that we have, and it will take a system response and a community response to really be able to detect it, prevent it, and respond. And you will have partners. I have found that no one's in favor of elder abuse, obviously. And often what the paralysis is more a sense of people don't know what they can do to help. So I signed up to tell them. And I think that's what all of you should do as well. You know, teach yourself about the topic and line people up. Will you help? And they will say yes. And because of that, I think we've made tremendous progress in the last 5 or 6 years, and I feel very good about the future of being able to tackle the problem. So thank you, John. I'll turn it back to you.
All right, and I think we have one other slide which has some additional contacts. So if we move to that one.
Right, yeah. Right. Edwin Walker, my Deputy Assistant Secretary, and Stephanie Whittier Eliason. Stephanie has been the key point person as we worked on the database that we've built as well as the guidelines. Great people for you to talk to.
Well, thank you so much, Kathy. Very important work, and certainly your personal passion on these issues has moved the needle a long way, and we appreciate that tremendously. Before we move on to Dr. Terry Fulmer, I want to remind everyone that we will be having questions at the end of this presentation. You see in the box that's on the right hand of your screen, there's a drop-down section for questions. Please go ahead and start asking your questions. I will be asking our panelists the questions as we come to the end of the formal presentations. So please go ahead and start doing that now, and we'll come to those quickly. So Terry, let's move to you. You obviously have been involved in this field for a long time and now have a new role as president of the John A. Hartford Foundation. So could you tell us a little bit about how you see the philanthropic world working in this arena?
I'd be happy to do that, John, and thank you. Thank you very much for your leadership at Grantmakers in Aging and for all you've done to bring this webinar to fruition. As president of the John A. Hartford Foundation here in New York City, I'm so pleased to participate, and I speak for all of us at the Foundation when I say we are deeply committed to using our resources to address this societal nightmare. And we're dedicated to improving care of older adults, and elder abuse is the antithesis of improving care. So we're all very, very excited about this work today and the work going forward. And I'm certainly honored to present with Secretary Greenlee, and it's so gratifying to have her champion this cause. And her presentation just shows us what leadership can do, and thanks for all the progress you've made, Kathy. It's exceptional. So this fundamental right to be free of all forms of elder mistreatment, abuse, neglect, exploitation, abandonment, and all the painful sequelae that follow is at the essence of what we're talking about today. And all of us would agree that prevention is the right strategy rather than trying to put an older person back together after mistreatment. But we have a long way to go in our nation, and in the assessment and detection and care planning of cases. That will be the basis for my remarks this afternoon. And I'll be discussing assessment strategies and 3 model programs that are inspirational. There are many more, but I'll call those out today. And we know that these model programs I'm talking about reflect the core values and key elements of programs we need to spread and scale to get this work to the next phase. I want to just remind all of us of our dramatic context. We have, as Kathy said, we have 43 million family caregivers. 15 million of them are taking care of someone with Alzheimer's or some other form of dementia. They're unpaid. They're doing heroic work, often without training or support, and we can do better. And I want to also always call out the Adult Protective Service workers as another group of unsung heroes as I get underway. So my first slide is to really just sort of remind us of the goals. And if you would move to that next slide, please. So I want to discuss screening and detection and care planning. And some of you who know me know that I'm a nurse and that I have focused my research and practice career on elder abuse and geriatrics, and that I really want to describe how our foundation is committed to practice improvement related to elder mistreatment. Next slide, please. So with regard to the approaches, and I'd like to make the following key points. Next slide. So the bullets that I'd underscore, and Kathy and I dovetail beautifully in this, is that elder mistreatment is difficult to assess. People ascribe issues related to aging and disease to elder mistreatment. It is not. You have to work in interdisciplinary teams. You have to develop a case management strategy and really look at evidence-based models of care. When we work with individuals and families and care providers, we have to look for inconsistencies with a history. And the Elder Justice website really is a gift to all of us as a resource, along with other resources like from the National Institute on Aging, HRSA, and universities, by the way. Next slide. I want to comment on screening, and there are many screens that are available in the literature, and here's what I often say to people. It doesn't matter to me what screen you use. It matters that you screen. And this point is related to work done by Wasson and Jetty and their colleagues when they talked about screening for women and domestic violence. It turns out that just one simple item attached to any instrument or procedure that you use in your agencies or in your world will capture this issue quite nicely. And their item was related to, is there any domestic violence in your life? And here again, this 10% number, 150 people said some, and 51 said all the time. So if we were just say, is there any elder abuse in your life you'd like to talk about? That's very powerful. So we want to make sure that we don't overwhelm any systems with complexity. Some organizations can go that next level of complexity for maybe for research or practice purposes, but a single item screen can be just so powerful. Next slide, please. This is the conflict tactics scale that so many of us know from Murray Strauss, who's at the University of New Hampshire. And there are multiple versions of the conflict tactics scale, but most of us would agree that if you are in a clinical situation or even, when you are conducting research, that this is really quite a gold standard. There's a 19-item conflict tactics scale. There's a 45-item. But again, it just is a way of organizing your thoughts around what you want to know and how you want to get a care plan going to intervene, reduce, prevent. Some samples to the right related to, and they usually go from less serious in terms of danger to more serious, although none of them are acceptable, whether someone insulted or swore at you, whether someone used a gun or a knife. So thinking about our ability to really come together around some common scales that help us all educate one another about what we can do next. Next slide, please. This is an elder assessment instrument that we developed in the late 70s, early 80s at the Beth Israel Hospital in Boston, and I'm using it for purposes today to talk about how we put this together and why, and how this works clinically and will probably not be useful to individuals who are in an office setting because it's more clinically organized. But let me say that the framework of this instrument, which we developed so long ago, was on theories of elder mistreatment, dependency, the inability, the cognitive decline, gatekeeping theories. And so that was, I'm thankful to Ken Meinecker and all of my colleagues at the Beth Israel Hospital in Boston who were so passionate about helping us as our Mandatory Reporting Act passed in 1979. Next slide. The components here, and for everybody to think about when you're screening, assessing for elder mistreatment, really is generally someone comes to your attention in whatever setting. How do they appear to you? Anyone, family caregivers included, who are visiting intermittently can take a look and see whether clothing, hygiene, nutrition, and the way someone's skin looks and make some sort of decision about whether or not things are changing or looking like they are problematic. Thinking about the more serious abuse indicators listed here, that's when you really need to begin to say to yourself, I need help. Next slide. Neglect is actually the largest category of referral for adult protective services. And this isn't self-neglect, it's neglect in both categories, and that is about 80% of the referrals will be for some indicator that people are getting what Terry O'Malley often referred to as inadequate care. And so neglect indicators, any of those that you see, they're clinical terms, but what you know is that they are indicators of perhaps failure to respond to obvious disease, the inappropriate use of medications. And there we were in 1984 talking about repetitive hospital admissions for probable failure of healthcare surveillance. And I note on each of these a statement by the older individual about the issue. If you ask an older person, they will tell you. And many of us have cases that we could describe. I certainly could. But I will tell you that when you specifically ask an older person, and even people with cognitive impairment can still have capacity, they will tell you about what is going on in their life so many times. Next slide. Here we have exploitation indicators, and I think Secretary Greenlee covered this very, very well. Right now there's a lot of momentum in our understanding of exploitation and financial mistreatment. And so I'm really happy about that, and I know the Department of Justice is doing a great job. If you look at the next category, abandonment can be another indicator of mistreatment. And if any of you recall, there was an elderly gentleman who was left at a dog track in Minnesota because his family did not want to pay for long-term care. And those are the overwhelming stories, but abandonment can be as simple as precipitously withdrawing care when somebody has been counting on you. So I give these to you as things to be thinking about as you continue your work in elder mistreatment. Next slide. Finally, no matter what you do, whether you use one item or not, you have to, what I say, call the question and say, based on what you've learned or what you've screened for, you have to decide whether you think there's no evidence or definite evidence and make a plan. And so it is all well and good to collect data, but it's all about the action plan. Next slide. So restriction, unnecessary restriction is another form of mistreatment. And here, this was work we did through a Brookdale Fellowship with Barry Gerland, and really thinking about, at the Hebrew Home for the Aged in Riverdale, thinking about additional areas where we have to be concerned. My door is locked, I can't open it, and that's when someone might go to the office for the day and leave an older person at risk. I wear a jacket or cuffs. You and I might call those restraints. And so-and-so warns me that they will punish me if I don't change my behavior. That's the threat of, I'll put you in a nursing home. So unnecessary restriction as a form of elder mistreatment is another theme that I'd like to just lay out there as we think about our important work. Next slide. Again, when you think about all the data you can collect and all the ways that you can participate, you have to have referral and follow-up. If you were to screen for elder mistreatment, the first thing you have to do is have a plan in place. And any suspected person, what is your referral plan? Will you call the primary care provider, whether it's your nurse practitioner, your geriatrician, your cardiologist? Will you call APS? And how will you get that call underway? Do you know your resources in your community? Do you have internal reporting systems in your organization, in larger organizations? And I go back to my example of the Beth Israel in Boston, Beth Israel Deaconess. We had an internal elder abuse team that everybody could call and access. Many places either can't afford that or don't do that, and that's fine, but you have to have an administrator on call who can work with you to get you to the right place. Sometimes you need to call the police. If someone is stabbed and they're older, that is not elder mistreatment. That is a felony. So one needs to be very clear about your plan. And then document your follow-up plan with a contact name and a number so that everybody can be participating in a meaningful and important way. Next slide. Barriers to research, and Kathy alluded to these as well. Problems with definitions, which I think we've come a long way. Case finding, over-reporting, under-reporting, and that is, if I do a presentation on elder abuse at Mount Sinai here in New York, the next day there will be cases, and that's because I've heightened awareness. And so sensitivity and specificity issues happen all the time, but that's okay. I'd rather have over-reporting than under-reporting, and all of us need to just be ready to get our work underway. Confidentiality, what happens when an older person says to you, my son beats me, but don't tell anybody? That's a really hard issue, and you have to have role models and practice, and I bet there are people on the phone who can add to that as well today. But it's really hard, and I'll say, and in our work, we often say, if I can be confidential unless I think you're in danger, and I can also put you in touch with people who might be able to help you. So it's hard. Difficulty confirming cases. We know Mark has done a lot of work there. Human resources needed for effectiveness are as Kathy just pointed out, this is a very human resource intensive area of work. But we need those resources, and older people deserve them. Intentionality is something that people talk about when they talk about elder mistreatment, and that is whether or not did the person mean it when they were abusing an older person or neglecting an older person. And that's where you do need expert input. And I think about a 90-year-old woman taking care of her 92-year-old spouse, husband, partner, and how if she thought that older person would be more comfortable and do better by lying on their back for a very long time instead of moving them, which she might think would cause pain, that person could get a pressure ulcer. You have to have analysis. You have to think about what's going on. IRBs can be a very serious barrier to research and to our ways of getting our work done. In one of our studies, we had to get 5 IRB approvals in 2 different states, and I know that that's being streamlined as we speak, so I'm pleased about that, but we continue to need to educate our organizations about research. There's not a lot, when we think about the Cochrane studies, there really is not a lot of work out there yet, and so I know that calls like this, webinars like this, and the work going on will make progress. So the next slide. Evidence from older people. And in the last few minutes that I have, let me talk about that and then talk about some wonderful programs. What do older people tell us when we think about working with them around elder mistreatment? They're afraid of loss of autonomy, that if we intervene, their loss of autonomy might be that we say, well, you're going to need a home attendant with you, you're going to need nursing home placement, we're going to need to take care of your checkbook for you. Autonomy is a crucial element for older people in the way that they think about this. I mentioned nursing home placement. Legal action against a family member. When people say, well, my son's a good boy and I don't want him to go back to jail, so I don't want to do anything. Retribution on the part of an abuser, where things can get sometimes worse by getting into the work, and all of us need to be finding new models, best practices, and new research that helps us. Loss of current supports, even if weak. I had a patient say to me one time, I know she steals my silverware, but at least she comes every day. So going back to the whole notion of how we can shore up family caregiving is really, really important. Next slide. Theory building, we need models for all of our work. Next slide. And this simply is one where we think about whether or not someone has cognitive impairment, whether or not they have a restriction or they have complete freedom, and how we think about those quadrants as we do our case finding and plan our interventions. Next slide. These I put on here intentionally, and they're in the literature, but they're for me to talk to you in the following way. This is a risk and vulnerability model for elder mistreatment because it's always a dyadic event where there is the older person and then the caregiver or caregiving team. And so vulnerability is what's internal to the older person, whether they're functionally impaired, cognitively impaired, whether they have issues internal to them. And then that risk is external, where you might have extreme caregiver burden or caregiver depression or poor social support for the caregiver. So I ask you to think about this in terms of risk and vulnerability, because both sides of the equation have to be addressed. Next slide. 3 models of care that I wanted to talk about. Next slide. So the exciting work of Carmel Dyer and her team at the Texas Elder Abuse and Mistreatment Institute is a call out for all of us about what leadership can mean and how impactful the work can be. So Carmel made it her plan that she would work on interprofessional collaboration, form associations, get her team of geriatric professionals together and work with Adult Protective Services, forensics, and law in order to make great progress in her Texas Elder Abuse and Mistreatment Institute with Baylor College of Medicine and her partners throughout that work. So I recommend to all of you to take a look at that work and think about the way they make a difference. Next slide. Here she has the clever acronym of TEAM, where they have clinical services, they work with APS, they have a fatality review team, they think about financial abuse, and they have really expanded their work throughout the entire state. Next slide. In that work, they also have a forensic assessment center and a network, which has been a real boost not only to Texas but to all of us as we access their important work and think about ways that we can use their best practices. Next slide. The Institute thinks about clinical services all the way through to the way that they do statewide registries to make sure that they don't have recidivism and that they can really understand how they are moving their needle. Next slide. Certainly, Laura Mosqueda has done an extraordinary job with the Los Angeles County and USC Adult Protection Team. This one happens to be hospital-based, around since 2000, partnering with the LA County Adult Protective Services, very important, with their evaluation of victims and then their forensics department coming together with home assessments with APS and social workers to provide continuity of care for vulnerable older people, and we thank her for that. Next slide. The team has now been available for over 360 older people monthly. Think about that. With a clinic, an outpatient department, a center, and their patients receive quality geriatric care and close follow-up, which is really probably what makes it so very successful. Next slide. I would be remiss if I did not do a shout-out to my own neighborhood and say that the Harry and Jeanette Weinberg Center, which is at the Hebrew Home at Riverdale with a wonderful tagline of Together We Can End Elder Abuse, is an organization that all of us should feel really excited about and take a good look at that. And what I would also want to point out is our New York City Elder Abuse Center that works in partnership with the Harry and Jeanette Weinberg Center, and we're learning a lot about respite care and about protective care where people can go and have safe housing is so important. Next slide. And here, what we know is that there's also comprehensive care, they fill critical gaps, special needs, and a wide range of training, which all of us can access, and community outreach. Next slide. So in summary, it's a wonderful opportunity for me to participate today and talk to you about the problem and to tell you that the John A. Hartford Foundation is committed to looking at ways that we can use our resources to work with all of you and move forward on a better world and eradicate elder mistreatment. Thanks, John.
Thanks so much, Terry. And I think we have one additional slide. So if we move to that one. And I'll ask Kathy to come back and talk about this important new report that she was involved with around better understanding the way in which our the public and both professionals and the public understand this issue? Kathy?
Thanks, John. I'll be very brief. A couple of years ago, I was trying to figure out why everybody in the world's not as outraged as I am about elder abuse, and was talking to some people thinking, how do we really move the issue, and had some advisors really point out if we're going to engage the general public on helping us attend to the problem, we have to find out what the general public thinks. And this kind of noodling over this problem happened at a time when Grantmakers in Aging had already engaged with the Frameworks Institute to look at broader issues about aging and ageism. And so we had the fortunate opportunity to marry all this work together with the support of the Archstone Foundation and Hartford Foundation. Frameworks then did a specific report to map the gap between what the experts in the field think about elder abuse and what the public thinks. The title, "You Only Pray That Somebody Would Step In," is a quote from someone who was interviewed. And this is a fascinating report to read. I would encourage anybody who just wants a good read to understand the gulf we're trying to bridge, I would encourage you to look at that report. And one of the most compelling is that there's a real sense that everyone's responsible and no one's responsible. And I think those of us who are so passionate about this are trying to sign the rest of you up to be in the everybody's responsible category, because it'll take all of us. But I'm very optimistic with this kind of guidance that we can bridge this gap and get more support from the general public as well as older adults themselves.
Thanks so much. Yes, this is fascinating work, and it will continue. This is the first of several reports that will be out on this topic. So now let's turn to your questions, and I will be reading them to our panelists today. And Terry, I'll start with you. It's a question around, are there significant racial and ethnic differences, or other kinds of differences like rural-urban, or people that have substantial financial resources versus those who don't? Are there things that our audience needs to be sensitive to in terms of those kind of differences?
So the data on demographics are not clear. I have seen studies that would indicate that there is a difference in, and there are racial disparities, and others that have not found the same thing. Having said that, we do know that people with cognitive impairment are essential to think about in terms of prevention and intervention. When you're vulnerable, if you have cognitive impairment, or if you're functionally incapable of taking care of yourself, you are a bullseye. And so I would say that that's the most compelling thing from the research.
Okay. Kathy, a question for you. Looking into the crystal ball in this, confusing political year, do you think there are opportunities to expand the federal role and federal funding in things like adult protective services or other aspects of this work?
Yes. I was very pleased. We have received in the current federal fiscal year funding a doubling of the effort from $4 million to $8 million as we continue to build out this national database, working with the states to connect to it. We do have support on the Hill, both parties, both chambers, and I think we've been successful kind of collectively as advocates at every level in raising their profile. It was significant that during the most recent White House Conference on Aging, the White House chose elder justice as one of the 4 policy tracks. And I think we've done what we can to lift it, and it'll just be incumbent upon all of us to keep going and keep talking about the need and the gaps. But I think there's increasing amount of support, which is really encouraging, I think.
Right. I'll stay with you for a second, although we'll ask Terry to answer this as well if she'd like. Is there an association between physical and mental abuse and financial abuse? And the subsequent question, is financial abuse usually initiated by trusted family or members or friends, or is it by an outsider?
I'll answer first and let the researcher give you the research answer. So, when I mentioned that we did this event at the White House in 2012 and we focused on financial exploitation, a couple of days before the event, I started to worry. It's like, what if they never talk about, the other kinds of abuse? And it was misplaced worry. everyone who works with someone who's been financially exploited understands the emotional toll that takes on an individual, and often the emotional abuse goes hand in hand with other types of threats or physical abuse. So they are all related. That doesn't mean any one person who has been victim of abuse receives all of different kinds, but they certainly are all interrelated. John, what was your second question? You kind of had a two-part.
Is it usually someone that's known and trusted by the person? Or
it's really all of the above. That there are certainly a lot of opportunities for family caregivers or trusted individuals in someone's life to take advantage, and there's a risk there. Part of the work we do on our coordinating council is with the Federal Trade Commission, where you see, scam artists, the telemarketers, the strangers, and the people who come in and overcharge someone for repairing their driveway. Those types of kind of almost consumer transactions, fraudulent consumer transactions, are still very much a significant part of financial exploitation as well.
Terry, anything to add?
I think Kathy's laid it out very well and completely. I would say that the only thing I'd add is that there can be long-standing patterns of really unconscionable behavior that, as Kathy mentioned, if one is abusive, generally speaking, there are a myriad of bad behaviors going on: money, health, food. There's a lot to be concerned about. That's very complex and interrelated. Most recently I've been out with the APS workers in Worcester, Massachusetts, and what they talk about is recidivism, and they talk about how hard it is to get to when you get to a family and you're making progress, and people will shape up for a little while and then go back to their old behaviors. So I really learned a lot from that, and I think all of us need to keep an eye on the long view.
Let's stick to that general topic for a second then, Terry. This is a question about the intersection between adult guardianship and elder justice in general. And I think, a lot of people think about guardianship, which is in some ways kind of fairly far along the spectrum. But do you think we have adequate tools for meeting these needs now in the legal system? And what would need to change to make that better to meet the full range of things we're talking about?
So at a fundamental level, my view is that we need to really be asking the Adult Protective Service workers that question, because they are right there all the time, and I'm thrilled that Kathy and her team have created this unified approach to not only the way that they do their work, but bringing together best practices. There's so much to know from that. I think that guardianship will continue to be something that will be needed. We have to make sure we have appropriate guardians, that they have the supports and resources that they need. It's a big step when one goes to guardianship. You're essentially taking over some of the autonomy of that older person. It's a very difficult decision. I worked with a group called Legal Research and Services, and it's a painful process, so I think we all have to be supporting those individuals as well.
And John, this is Kathy. I would just refer people back, if they're interested in this topic, to the resource center that I put up on supported decision-making. In guardianship, it could be an entirely separate webinar, because there's a lot of innovation and change that needs to happen in the world of guardianship. People in that space who know we need reforms. I agree with Terry. I think there will always need to be that legal structure. It's not a panacea, and we need to continue to figure out how to support people, whether they're in that legal structure or not.
Right. At this point, unfortunately, we're coming towards the end of our hour, and I would like to ask each of you to provide your final words of wisdom to our audience. And Kathy, I'll start with you.
Well, I just want to thank everybody for showing up today, and try to encourage you not to be overwhelmed and excited and encouraged about the topic like Terry and I are. This is something that means so much about supporting and recognizing the dignity and independence of all of us as we age, and we tend to talk about older adults as like they're someone else, but we are an aging country. All of us need to be recognized and supported as we age. And I'm just outraged that this issue is so silent. everyone can do something, and I just encourage people to figure out what's your role, what can you contribute, and if we all do that, we can start to bend this and make a difference. And it will be always important that we stay in touch with older adults themselves. I think one of the major concerns I have about the work is it's driven by the rest of us who want to help, but we really need to meet with victims. I have met with victims. Terry has worked with victims. If you don't know where to start in your community, go find the victims and talk to them, and they will lead you to places where you need to be in order to provide support for them.
That's really wonderful. Terry?
I think that was beautiful as well. And I guess that I would close on someone who was so impactful to me, and that was Louis Sullivan. When Louis Sullivan was head of Health and Human Services, he said, elder abuse is not a law and order issue, it's a health issue. And with that, he brought to bear over 4 million clinicians into the conversation. We need everybody, as Kathy says, and we need to go beyond clinicians to make sure that everybody is concerned and making a difference, and that's why we have so many people on the call today, so thank you.
Well, thank you. I want to thank Kathy Greenlee, the Administrator of the Administration for Community Living and U.S. Assistant Secretary for Aging, and Terry Fulmer, the President of the John A. Hartford Foundation, for their participation in today's program. We thank you for all you do and for your tremendous passion in this very important but often neglected and difficult issue. I also want to thank the John A. Hartford Foundation for their support of this program and our co-sponsors today, the Administration for Community Living and Grantmakers in Health. We will be making this presentation available to anyone who wishes to view it later, including both the slides and the audio. Please watch for the rebroadcast link on our website or contact Grantmakers in Aging at info@giaging.org. And finally, we want to thank all of you for all that you do to make life better for older people, and we wish you a great day.